Hi, my name is Jamie from meetjamie.com. I'm an independent insurance agent helping people understand the Medicare program and find the coverage that fits their needs. So in today's quick video, I wanted to talk a little bit about what are Medicare supplement plans. And so hopefully you'll find this video helpful. If you do, subscribe to my channel, hit the like button, and leave me a comment with questions you have about Medicare. You can also schedule a free consultation with me on my website at meetjamie.com. I'll leave a link in the description below. So I'm just over on Medicare.gov looking at their definition of Medicare supplement insurance, also known as Medigap plans. One thing I just want to really be clear about is that Medicare supplement plans and Medicare Advantage plans are not the same thing. A lot of times I talk to people and the language they use gets kind of mixed up. Supplement policies, as we're going to find out today, are sold by private health insurance companies, and they're meant to follow or complement your original Medicare A and B. So as you can see right here, Medigap is Medicare supplement insurance that helps fill gaps in original Medicare and is sold by private companies. Original Medicare pays for much but not all of the costs for covered health care services and supplies. A Medicare supplement or Medigap policy can help pay some of the remaining health care costs like co-payments, co-insurance, and deductibles. And so then this just gives you a little explanation here that there was a rule change in 2020. Certain people who turn 65 after January 1st can no longer get Plan C and Plan F. But that's for a different video. So the important thing to know is that some Medigap policies also cover services that original Medicare doesn't cover, like medical care when you travel outside the US. So if you have original Medicare and you buy a Medigap policy, here's what happens. Medicare will pay its share of the Medicare approved amount, and we'll just look at this little pop-up here. It says in original Medicare, this is the amount a doctor or supplier that accepts assignment can be paid. It may be less than the actual amount a doctor or supplier charges. Medicare pays part of this amount and you're responsible for the difference. So again, after Medicare pays the approved amount, then your Medigap insurance company pays the share that is your responsibility. And so then it just has this nice list here just going over what you need to know about Medigap policies. Number one, you have to have Part A and Part B in place. Number two, again, I mentioned this at the beginning of the video, but it's worth reiterating. A Medigap policy is different from a Medicare Advantage plan. Those plans are ways to get Medicare benefits, while a Medigap policy only supplements your original Medicare benefits. Number three, you pay the private insurance company a monthly premium for your Medigap policy. You pay this monthly premium in addition to the monthly Part B premium that you pay to Medicare. Number four, a Medigap policy only covers one person. If you and your spouse both want Medigap coverage, you'll each have to buy separate policies. Number five, you can buy a Medigap policy from any insurance company that's licensed in your state to sell one. Number six, any standardized Medigap policy is guaranteed renewable even if you have health problems. This means, and this is important, the insurance company can't cancel your Medigap policy as long as you pay the premium. So you're going to want to make sure that you do that. I recommend with my clients they do an electronic funds transfer from a bank account. Number seven, some Medigap policies sold in the past covered prescription drugs, but Medigap policies sold after January 1st of 2006 aren't allowed to include prescription drug coverage. If you want prescription drug coverage, you can join a Medicare prescription drug plan, also known as Part D. If you buy a Medigap and Medicare drug plan from the same company, you may need to make 2 separate premium payments. Again, you can speak to the company to find out how to pay your premiums. Finally, number 8, it's illegal for anyone to sell you a Medigap policy if you have a Medicare Advantage plan, unless you are switching back to original Medicare. And then it just kind of shows you that Medigap policies don't cover everything, like long-term care, vision or dental services, hearing aids, eyeglasses, private duty nursing. So, just to recap, Medigap plans supplement original Medicare. And so the insurance plans, other plans that are out there that aren't Medigap would be Medicare Advantage plans, Medicare prescription drug plans, Medicaid, employer or union plans, TRICARE, veterans benefit, long-term care insurance, and Indian Health Services, tribal and urban Indian health plans. So, dropping your entire Medigap policy, not just the drug coverage, you may want a completely different Medigap policy, not just your old Medigap policy without the prescription drug coverage, or you may decide to switch to a Medicare Advantage plan that offers prescription drug coverage. If you decide, this is important, to drop your Medigap policy, you need to be careful about the timing. When you join a new Medicare drug plan, you pay a late enrollment penalty if one of these apply. You drop your entire Medigap policy and the drug coverage wasn't credible prescription drug coverage. You go 63 days or more in a row before your Medicare drug coverage begins. And then there's just some additional resources like find a Medigap policy, speak to a state health insurance assistant, and so on and so forth. So that's, again, just a quick overview of what are Medicare supplement plans. I work in multiple states around the country. If you have other questions about Medicare supplement plans or you want a free quote, you can always reach out to me again at my website, meetjamie.com, or you can reach me toll-free at 800-974-0552. I'll leave all that contact information in today's video. Again, if you like this video, please hit that subscribe button, leave a comment, let me know where you're watching from, or if you have questions, and thanks for following along, and we'll see you in the next one. Have a great day.